In this extract from the DECEIT Syndrome, Rob is talking to his old friend Rosa. What do you hear in your medical circles of those American health maintenance organisations and accountable care organisations being introduced? Rosa asked Rob. She didn't wait for an answer. It's as clear as day that those government documents, the 5-year forward view, their so-called sustainability and transformation plans and the 10-year plan are nearly the last pieces in the jigsaw of their privatisation policies. The first was presented at Davos to the World Economic Forum, apparently. It has been claimed that SDP stands for Slash, Trash and Privatise, or Secret Tory plans. I gather in an effort to make it seem as though there is an argument, they now call them partnerships instead of plans. And another name change to integrated care systems. They really do think the public are stupid to be fooled by that old tactic. You heard the late great Professor Hawking, Rob responded. They didn't call him a genius for nothing. It wasn't his field, but he was spot on. He summed it up in a sentence. The NHS is being replaced by 44 US-style insurance-based private organisations, no question. The then Health Secretary, who always looked a bit spaced out, said he was wrong. It's as easy as deciding whether you trust a Mensa intellect or a dead slug with your future healthcare. Judgment without knowledge should be a crime. That would mean most politicians should be locked up. What a result. Rosa thought as much and let Rob continue without expressing her dark thoughts that Hawking's death had come at a very convenient time, a bit like David Kelly's. The accountable care organisations were, as you say, conceived in the USA. They involve government and private insurers awarding contracts to commercial providers to run and provide services. That is total privatisation. They are non-NHS bodies. They decide which services are available, who gets them, and what to now make people pay for. Quality is generally worse and costs higher. There has been no public consultation. They suck in social care, which of course is means tested. So this has far-reaching implications for the availability of free healthcare. They won't allow a debate on this either. The ACOs, or should I say integrated care systems, front a network of private companies, private providers and insurance companies. Us GPs are now being forced into networks of up to 50,000 to start with to deliver through these integrated care systems. Forced and bribed, of course. Property companies are jumping on the bandwagon too. Haven't you noticed that when huge developments are suggested, they hold out the carrot of a new health centre? And yes, the clinical commissioning groups are merging with SDPs. None of this has been voted through either by the public or Parliament.